Namaskar, I am Dr. Tapush Basu, consultant occupational therapist. Today we are going to discuss about the causes of autism. What is the actual cause of autism? Let's know. Usually we see all the parents are suffering from a dilemma, and that is simply caused by misinformation about the cause of autism. Let's clarify it today and let's know the actual medical science. What are the medical sciences are there behind this autism? Let's see. So, there are two types of cause of autism. One is genetics, another is epigenetics. What is genetics? See, genetics has two components. One is inheritance, like we usually believe that as parents we always think like we are having some difficulties, we are having some problem, that's why my child is getting autistic, or his or she is having this neurodevelopmental disorder. Is it right? Let's know. So first of all, what is inheritance? Inheritance means if in your family there are such kind of conditions or there are such kind of traits and it is passing through the genes, then it is happening to your child, then you can say okay, it's inherited. Like as father is having speech delay, or paternal uncle is having speech delay, or maybe grandfather was having speech delay, and that's why your child is having speech delay. So it is an inherited cause. And in some cases like autism will also present inheritedly. And next one is the genetic. Genetic means in family there is no such history, nobody has such kind of problems, but your child is having such kind of problem. It means your child is having individual genetic mutation which is causing autism or such kind of neurodevelopmental disorders. And that is very much important because many times we can see there might be some syndromic presentation and autism is a comorbid part of that. So that's why we have to know which gene is mutated, and because of that this kind of problems is happening. Like Fragile X syndrome, we can see that Fragile X syndrome, autism is a comorbid factor. So what we do whenever we are assessing the gene, we can see okay, this kind of mutation is there and this gene is affected, so we can predict that okay, this child is going to have autism traits as well as like learning disorder traits or intellectual disability. So that's how we have to determine the actual factor which is responsible for the neurodevelopmental disorder or autism. Like if we don't know the actual cause, then it's very difficult to treat such kind of child, because you can see you have done so much therapy for so long time and you are not getting any such result, because you are not identifying the contributing factors and you are not treating those. You are doing wholesome thing which may not like applicable for your child. Next is epigenetic, like environmental factor which is responsible for autism. So we can see there are some drugs like thalidomide. It has been used earlier to pregnant women, and we can see that it causes a lot of children with neurodevelopmental disorders. So it has banned now. And there are some toxin exposures like lead, mercury, which may cause autism or such neurodevelopmental disorder. And most importantly, during pregnancy or just before conception, what was the maternal health condition, physically as well as emotionally? That is a very big contributing factor. We can see if a mother is having diabetes or like high stress, hypertension, we can see that child is having some kind of difficulty with development, and sometimes it may causes autism also. And we have to always look after the thing that during pregnancy, if mother is struggling for longer duration, that may cause autism also. So there are so many factors, and one very essential factors is like during delivery, if it is happening preterm, or if it is like instrumental delivery or C-section delivery or natural delivery. So these conditions can contribute to the autism also. As well as after delivery, if we see that child is not crying at birth or child has cried delayed, so that can be a big factor of neurodevelopmental disorder like cerebral palsy or sometimes autism also. And we can see that after birth, if there is such kind of infections like bilirubin encephalopathy or you can say meningitis, so in such cases we can see that this condition may be a big factor for autism also. So in our clinic, what we do, we first assess all these areas so that we can have the actual contributing factor towards the autism, and gradually we treat according to the contributing factor, and we can see that every child is getting better over here, because we always diagnose the root cause and then we follow the treatment. That's why you can see a huge improvement in the all child, is it autism or maybe any syndromic, genetic syndromic child. We have seen that every child does better over here.